I'm Javad, founder of the HammTek. My background is in tech, health tech, technology and engineering. During the past few years, I focused on two big issues, shortage of the healthcare workers and aging of the population. That's linked me to the HammTek idea. We are team of 10s, including technical teams and then business and regulatory and a team of dentists for support of science and what we have plans for developing in future. HammTek is a simple product for monitoring the oral health. Product contain hardware and software. Our device record the teeth videos, and then we have a smart application that can analyze the videos and detect abnormalities. The teeth placed between these two cameras, and we use the illumination method. We shine the light from one side and record the videos from other side. So we can record the videos from the area between the teeth, or even we can see some area inside the teeth by this technology. And then you have to record the videos from different region of your mouth, and the device connected to the mobile phone, a smart mobile phone, and then a smart application analyze these videos and detect abnormalities like plaques, gums infections, gingivitis, and cavities. It's designed for non-specialists like nurses, caregivers, or even family can use it without any dental training. And of course, we can share the videos and results with the dentist if needs. For elderly people, the health oral problem ignored until they become pain, infections, or some expensive treatments. So HammTek can help them for early detections.
How long have you been developing HammTek at the moment?
We have started about 3 years ago. And during these 3 years, we developed our two versions of the HammTek, and we trained our AI by ourselves. We built our database, included more than 3,000 labeled images.
How easy it is to use? Will the older generation with limited technology be able to use it?
I'd say it's very easy to use. Of course, that's our biggest goal of the design. The device, the application guide the users step by step during the recording to the videos. How you have to record the videos, and what's the next after recording. We have guidelines in the application. And about the older people, I'd say that actually they don't use the device by themselves. The idea is that a nurse or caregiver operated the device and monitor their mouth health situation by our product. The elderly people, they don't need to handle the technology. during using the product. And regarding to the languages, the application is designed for multi-language usage, and currently it supported the Finnish and English.
What kind of feedback have you received from the users or test groups, like from professionals or ordinary people?
Yeah. Actually, we had several trial days in Helsinki and Espoo. And during our trial days, we had about 150 volunteers. And we have received a lot of positive feedbacks. And also we had one pilot in Attendo nursing homes with collaborating of Satakunta University. And after this pilot, we have also received the good feedbacks from the nursing home staffs and manager. And the main feedbacks was related to easy to use, fast performance for regular checkup, and very helpful for monitoring over the time. And also, currently we have one ongoing pilot with one home care in Helsinki.
How you see the future of the HammTek and the similar technologies?
I'd say regarding to the shortage of the healthcare workers and aging of the population, using the HammTek and other technologies can help the quality of the elderly people life, and I'd say it's necessary to use in nursing homes and healthcare facilities, better life quality, and also it can help the nursing home and healthcare facilities staffs to have a better information regarding to their patients, and for sure when they knows the patient's health situation, they can have a more peaceful minds, and it makes less workload, and also it can reduce the cost for both patients and facilities. So I'd say we have to believe the AI, we have to believe the technology, and we have to trust on AI and technology if we want to fix these challenges in future. Actually, when we talk about the health and healthcare, on top of that, we need the support of the government, because actually the government usually they are responsible for the health situation of the people. And if staffs, families, people, they use the technology by themselves and the government doesn't support this kind of technologies, it means that there is some limitation for using this kind of technologies. For example, if I talked about the HammTek, when one nursing home or one family, they use the HammTek for monitoring their mouse situation and mouse health. If the government doesn't support the HammTek in their own system, then how the nursing home can share this information with the healthcare area? How the families can refer their teeth and gums issues with the healthcare area? They even if they find some abnormalities by the HammTek, it means that they have to have a travel to the healthcare area again. And this kind of limitation caused that people get frustrating to use the technology for their health monitoring.
Well, you already told me that you have had pilots in nursing homes and like you have received a good feedback from those. You probably see that HammTek is going to be useful in elderly care.
Yeah, absolutely, yes. Nurses and caregivers can use HammTek for routine screening. That means early detection, fewer infections and emergency visits, better quality life for elderly people, and less workload for dentist professionals. And usually the elderly people, they have limited with mobility. And one other issue is that usually the elderly people, they don't complain about the small pain in their mouths unless it's serious.
What's the next step for HammTek?
I'd say more pilot and enter to the market smoothly.
Okay, I think that we can conclude this interview at the moment. Thank you very much for joining me
Yeah.
and waiting for me because of the snow.